Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvira Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. Actually, today's lecture is Balrog or Kaumarbhritya tantra subject for the third year BMS students. But this particular today's lecture is also interesting for the common man because they are doing these procedures in day-to-day life. In the generation to generation, everybody knows. Without knowing the Ayurveda, without knowing the Kashyap Samhita, it is coming as a generation to generation teaching, and everybody is following not each and everything, but some of these procedures, samskaras, are followed for the child or the baby in our houses. So this is a just understanding the science behind that samskaras. The samskar is a word used many places in Ayurveda. Especially it is used in the Ayurvedic pharmacy. And it is said that samskaro nama gunantaradhanam. Samskaro nama. So if anybody student wants, you can write down this statement in the beginning because any question asked about samskara, first line you should mention as a samskaro nama gunantaradhanam. That means change in the qualities for the better. That means the removing our defects from the medicine, from the person, and getting the good qualities in excess. Removing the bad qualities and getting the good qualities in excess, that is samskar. Change in the features, but in a positive direction. We are not talking about kusamskar. In the Marathi language, there is also kusamskar. And there are two words, susamskar and kusamskar. But all these procedures mentioned in the Veda Vangmaya, Rigveda, Yajurveda, Atharvaveda, Samaveda, and also in the Charaka Samhita and Kashyap Samhita, they are for the good. They are for the good purpose, nice purpose. So first I will request my students to write down only the names of today's samskaras that we are going to talk about. So first I will dictate them. This is a Jata Karma Samskar. So I request, ready, open your notebooks, 21st of February, put the date, and only the name, don't write anything else. Only 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Write down. Jata Karma. Immediately after birth. Jat, birth, Jat. Jata Karma. Karma is a process. Immediately after birth, that is Jata Karma. Second, Namakarana. My name is Rajendra. Student's name is Ankit or anything else, XYZ. That we get the name very earlier in our life. That is Namakarana. Getting the name for us identity. Because in our patient also, we must write down the name, gender, age, occupation. These are the basic requisites to understand the person properly for identification purpose. Namakarana. So you can write down third one, Dola Shayana. Dola. Dola Shayana. Can you see the action? Dola Shayana. Dola is a cradle. Dola is a cradle. So one has to put the baby in the cradle to little bit training of living independently. Dola Shayana. That is a cradle. Okay. Fourth, Surya and Chandra Darshana. Surya and Chandra Darshana. So the child has to taken out from the living place to expose himself to the environment. To expose for the environment. That is Surya, sun, and Chandra Darshana. To show them Surya and Chandra. Okay. Next is a Nisha Karma. N-I-C-H. Nisha Kramana. Sorry. Nisha Kramana. Nisha Kramana. Kramana means to take out and move around. Nisha Kramana. Nisha Kramana. Then Upaveshana. 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 That is to make the child to sit. To make the child sit. Upaveshana. Okay. We will see all the details. Seventh is a Phalaprashan. Phala is the fruits. eating, starting the juices and chewing the oranges and all these things. So that is a phala prashan. Phala is a fruits. 8 here. Karna Vedana. Everybody can see there is one hole. You can go to the mirror and see. That is a Karna Vedana in the childhood. My father and mother, they have made this Samskar. Karna Vedana, piercing the ear. Okay. 9th, Annaprashan, starting to eat the solid food. Starting to eat the solid food. 10th is a Chuda Karma. Is a Chuda here. Shaving, removing the hair and putting the bunch of the hair over here. That is Chuda Karma. That is the 10th Samskara. This is a typical Samskara which gives the betterment for the baby's life. Then, can you see 11th? Vidya Arambha. Sri Ganeshaya Namaha. Vakratunda Mahakaya Suyakoti Samaprabha. Nirvignam Kurume Deva Sarvakareshu Sarvada. Knowledge gaining process starts. Vidya Arambha. Arambha is the starting. 12th, Upanayana. Upanayana. Upa means near. Nayana means to take. The child is doing the Munja Samskar and going to the Gurukula system, to his teacher in the forest at that time. So learning process, more advanced learning started. Now lower KG and senior KG and first standard, etc. Playing group, etc. Then Keshant, that is a Keshant. That means basically removing the first small, what you can say in Marathi, it is called as soft hair, love, premature hair, and shaving is started, and the grown-up child, grown-up youngster has started his life. So that is the 13th Samskar. So all these Samskaras, we are going to discuss slowly and steadily about each Samskar. But I think you have written some of the names. Again, at the same time, you can write whatever there is missing. Just a moment. Again, we mark the portion so that the concentration is possible. Because of the marking, the color, specific color is appearing. So, Jata Karma. Now, not necessary all the things you write, but if you can want keywords, K-E-Y, you can write down only 1 or 2 words. Immediately after birth and cutting of umbilical cord, Nabhi Kartana. Nabhi Nala Kartana. I'm sorry, not Nabhi. Nabhi Nala Kartana. What we have to do, the father and mother or the parents and the relatives, mixture of equal quantity of honey. Madhu means honey. And ghrita, ghee, sanctified by mantra. Om. Like Veda mantras. Different mantras are available. Gayatri mantra. Om Bhurvhu Swaha. Om Tat Savitruvarenyam. Bhargo Devasya Dhimahi. Dhiyo Yo Nah Prachodayat. Om Namah Shivaya. Om Namah Shivaya. Om Ganapate Namah. Whatever mantra you are, what you can say, the culture is advocated, you can do that mantra. It's not any religious thing. Whatever you have from your generation to generation, that mantra can be chanted just to purify all the process. Given to the neonate by the ring finger of the feeder. Can you see ring finger? Ring finger. You have to give the ring finger chatana of the feeder who is giving, especially mother or the grandmother. What Acharya Sushrut has mentioned to administer madhu, honey, of course, ghee, and Brahmi Swarasa and Swarna Bhasma. So here you can see that he has added Brahmi, which stimulates the intelligence. Brahmi is a plant for brain tonic. And Swarna, Saptadhatu Vardhana. Saptadhatu Vardhana and Oja Vardhana. Swarna is best for Oja, immunity. Like we do the vaccination. Here the Swarna Prashana Samskar is there. Swarna Prashan can be compared like a vaccination. It can give your immunity if it is done systematically. 62.5 milligram it is added over there. Charaka suggested to administer Madhu, Bhruta and Swarna Bhasma. So both Sushrut and Acharya Charaka has given the importance to the brain development, nervous system development and immunity development. Madhu and Ghrita are administered in equal quantity even though it is considered as a matra viruddha. In our whole life, we never advocate that give the honey and the ghee in equal amount. Never, never. Viruddha anna, toxin. But here in the infant, Vayu gets aggravated because of the stimulus. We want to give just stimulus, not for nourishment. First is for the stimulus. Afterwards, you don't mix it in equal amount. Then you can differ. Kapha Prakriti Pradhana child, then Madhu is more, ghee is less. Vata and Pitta Pradhana Prakriti child, then ghee is more, honey is less. See, afterwards you adjust the dose. But in the beginning, first chatana only, you can give in equal amount because it is a stimulus, stimulating the immune system of the newborn child through the method of what you can see is Viruddha, Viruddha Abhishakti. It is the power of that stimulus. It also acts as an immediate energy provider for the child. This is the importance of this Jata Karma, Chatan, Lehya. We have already seen that chapter of Prashana and Lehana Samskar. So this is one of the Lehana Chatana Samskar. Okay, licking. Chatan is a licking. Next. You can see Namakarana Samskar. Please write down the name Namakarana. You also remember these days because again, always each lecture Dr. Deshpande is mentioning something about ARAPGET, MD and MS entrance examination. They will ask you these definitions, these days, etc. Whenever there is a number, it is important for the entrance examination, MCQ, multiple choice question. So this is either you can do 10th day or the 12th day or the after 3 months. Okay. Mother and child both are getting bath with medicated water, put on neat and clean clothes. So everything should be auspicious, sacred and light ornaments. Then Swasti Pranidhana, worshipping of the god, Homa Yajna is performed. Child is made to lie down with head facing the east. East Disha is always auspicious. The father of the child prays to the god and give 2 names to the child. Remember, 2 names. Then one name based on the intended meaning and opinion, the other based on the constellation under which the child was born. That is according to the nakshatra. So here also you can understand Ayurveda has some link with Veda sciences like astrology, mathematics, these are, and Ayurveda. So Jyotisha, Ayurveda, Ganita, mathematics, all are the Veda sciences, Vedic sciences. So Vedic Ganit, you might have been heard about Vedic Ganit. So it's a very tricks to solve the problems, mathematical problem. Vedic Ganit, Vedic astrology, so Vedic Ayurveda. So they are interlinked, try to understand. Social gathering, we invite the people, we make this festival, get together, and many people observe the infant and opine their views to the features and appearance of the baby. Looking very smart. Oh, my sweet child. Oh, nice baby. Going to a face is like a father, eyes are like a mother, nose is like a XYZ. So always there is a chit-chatting with the invitee people. It helps to roughly assess the healthy status of an infant. His face is smiling. The viewer is saying, face is very nice. So immediately we get the idea, okay, the child is growing well, he is looking healthy. Okay. By conducting the naming ceremony, a social identity like Aadhaar card, we can make Aadhaar card. Identity is created for the child. The child will be addressed by the given name, by the friends, by the relatives, which helps in assessing the hearing and responding capacity of the child. Raju, here, Raju, come on. So we can, he now link his name and his own identity. So naturally he will respond whenever somebody calls by his name. So there are different aspects of each samskara. Different importance of each samskara you must understand. And you have to write down in the examination what is the practical utility of, or it is only a Vedic samskar. No, because it is said, Baba Vakyam Pramanam. No, 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 no. It is okay, it is Aptopadesh, but still it has some pratyaksha significance is there. We can draw some anuman, logical inference, why this is important. We can explain, we must be able to explain. Then only the people will understand this science. Otherwise, they say, oh, it is only miracles, nothing else. But no, we are explaining each thing on a scientific ground. Next, we will talk about this third samskar. Write down the name. Dola Shayana, 12th or 13th day. Dola means cradle. We purchase, but in some families, what I have heard, I don't know the significance. No, no, no. In our family, we don't bring the cradle. We take it from the somebody relatives. I don't know what is the purpose of behind that. But yes, anyway, the cradle is decorated with flowers and toys, which definitely when something is moving on the top, the child is looking here and there, movements of the eyes, hearing capacity will increase. First, a clean and round stone is placed in the dola and worshipped. Later, that means first stone has to be prepared as a symbol, okay, that we are going to put some weight over there in the cradle, dola, okay. Later, the baby is east fed. East this direction is always important, and made to sleep in the dola cradle. Up till this point, mother and child are like the close contact in the lap. And now, this is the first time mother is giving slowly and steadily training to the child to be get separated. Because when he will start growing, he will not always in a lap, no? So there must be some starting point to understand him. Yes, I have some separate identity, and there should be some time he should be kept separate. That is the purpose. By the age of 10 to 12 days, the thermoregulation, very important, in the newborn will be stabilized. Till that time, the child is not adjusting his own hypothalamus has not developed. Heat center and cold center has not developed. Brain development is slowly going on. And approximately on 12th day, it is assured, no, no, okay, the child can live, can lie separately. Because till then, the baby, the mother is giving warmth to the child. Because the independent thermoregulation is not properly established. The risk of hypothermia is now less. The newborn also starts to regain the weight which was lost in first 10 days of life, which may contribute to the deposition of subcutaneous fat. Fat development has started, which is called as a thermoregulator shock absorber. So whenever there is fat, nothing to be worried about. Hence, the samskar is a way of assessing the development of the baby, whether he is developing hypothalamus, thermoregulation, all this physiological development is assessed by these samskaras. This is the most important. Now, next, fourth one is Surya and Chandra Darshana. Please write down. First month, after completing the first month, after conducting the Raksha Karma, all the home and Havana and other auspicious procedures, the child should be shown the rising sun, Suryodaya, sunrise, along with its worship. Gayatri Mantra is a mantra of Surya. Om Rave Namaha, Om Adityaya Namaha, Om Suryaya Namaha. So naturally, when the child will be of 5, 7 years, he will understand the importance of sun energy, which is the ultimate energy source on this earth for the human being. We are getting the energy, last energy, main energy from sun, but we are not able to direct perceive the energy. The plants are taking that energy, and then we are eating the plants and we are getting the energy. But in the world, sun is the ultimate source of energy by all the way. Okay, so it is best for the body, best for the mind, best for the emotion. Okay, so and the moon in the first part of the night. So both are these deities, I can say. These are the principles of heat, and these are the principles of cooling, Shita Virya and Ushna Virya. So the child is now exposed to the universal heating principle and cooling principle. The child is exposed to the universal, global heating principle, that is sun, and cooling principle, that is moon. If he is exposed, then automatically his body, Ida and Pingala Nadi, will be balanced. The eyes are not completely developed anatomically or functionally at birth. So he is not exposing, he is not opening eyes because light cannot be tolerated by the child. So always sleeping, most of the time 16 hours, 17 hours, he is sleeping. Slowly, everything will start and are constantly changing during the neonatal period. These eyes, about eyes, focus on the bright objects like Suryodaya, sunrise, helps to stimulate rods and cones in the retina. Rods and cones will be stimulated. Our reticular formation system in the brain will be stimulated. Circadian rhythm will start. Biological clock will be set. The child will slowly understand, oh, morning, oh, afternoon, oh, evening, oh, night. And whenever these effects of light will start acting on the brain, automatically biological clock will start setting. Very interesting thing about these samskaras. Next, fifth samskar, Nisha Kramana. N-I-S-H, Nish, Nisha Kramana. Fourth month. After bath of the child, getting the clean clothes, purification, Dakshatirthat Shastrartho Drishtakarma Shuchir Bhishak, Vaidya, all the staff in the society, Bharat Swachha Abhiyan. So everywhere the most important cleanliness is important, and light ornament should be put on the child. Then this child is taken out of the house along with the mother to go to the temple and worship for the first time. So he is now making salute to the God Almighty. So this is a union of Jivatma and Paramatma. Jivatma and Paramatma. God Almighty is a Paramatma, and we are having the individual soul. So this is that first time, like a child is gratitude. Child's gratitude is expressed by taking his to the temple. Oh God, you are our father, and we are your children. So Jivatma and Paramatma, Jiva Shiva Sanyoga will take place when the child will go to the temple. Child is able to appreciate when we are moving outside, naturally external environment. There is a sunlight, there is air, there is a Shabda, Sparsha, Rupa, Rasa, Gandha, 5 sensory organs. There will be traffic noises. People are talking around. Then there will be some smell, maybe good, maybe bad. There may be, what you can say, while going, the child is taking some licking. So taste is there, smell is there, touch of the different things is there. So all the 5 sensory experiences are stimulated when the child is taken to the outside of the house. So that is occurring in the 4th month, taking the child outside of the house. Next samskar, that is 6th one, Upaveshana, 5th or 6th month, conducted on an auspicious day after worshipping God. At the center of the house, a square-shaped platform is made of the cow dung and water, on which ornaments, cereals, and toys. Of course, the child is with toy are placed. The child having taken bath wearing a clean and new clothes is made to sit on the platform facing always east direction for as per capacity. It is mentioned 48 minutes, but it is not compulsory. Hold the child for 48 minutes. No, 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 no. But you have to stimulate his further physical progress. Further physical progress. Sitting, standing, walking, running, step by step. By the 6th month of age, the child should have developed sufficient ability to sit with support, vertebral column, all the vertebrae. It should be enough strong, pelvic girdle, your femur bones. That much holding capacity, bony strength should have been developed during this time. So it is like assessment. It's like a assessment, clinical assessment. Too early initiation of sitting. That means if you make force in the 3rd month or 4th month, no, that is not good. Sitting makes the infant's body more weak. There may be bend at the back, painful, and child may get affected because of this unnecessary force and strain on the bony and ligaments and muscles. The child may get inflammatory process in the body and he will start getting fever. And that all these disturbances in the physiology will hamper his normal growth and normal development. So don't be in a hurry. Go slowly and steadily. Slow and steady wins the race. So here the instruction is very specific. Don't make premature type of activity. Next is a phalaprashana. Phala, fruits. That is 6th month. This is the first step towards the weaning. This word is very important. Question is always asked in the oral also. What is weaning? So please write down W-E-A-N-I-N-G, weaning. Stopping the breast milk and starting the outside little bit liquid and then the solid food. That is weaning. Weaning is slow, step by step stopping the breast milk is called as weaning. So this word is important. It is the process of administration of the fruits. You can give juice or even a little bit chewing, but chewing is very difficult so that the child can digest them easily. By the 6th month of age, the nutritional requirements of the infants start increasing. He wants more calorie. He wants more protein, carbohydrate, fats, vitamins, mineral, more and more and more. Not only breast milk is sufficient. Okay. So breast milk might not be sufficient to fulfill the nutritional demands. So feeding of the fruits has been advised by Kashyap, Acharya Kashyap, the great pediatrician at that time. The GIT, gastrointestinal tract, that is digestive system, is not fully capable of digesting solid food at this 6th month. So easily digestible fruits should be administered in the form of juice or crushed form. Immediately we cannot start the solid food. This is very similar. I remember Panchakarma. After Panchakarma, anybody remember what we do, the dietary advice and the lifestyle advice, how we go from mild to moderate type of activity? Yes, that is called as the Samsarjanakrama. Samsarjanakrama. That is very important word after Panchakarma. It is not actually Samsarjanakrama, but it is weaning. Weaning is a proper word. Stopping the breast milk. Now, next is a Karna Vedana. Karna, ear lobule. That can be done either in the after completing 6th month or in the 7th month or in the 8th month. Usually, always, as I am saying, it is a connection with the little bit astrology. Auspicious day is selected. The child is made to sit on the lap of the mother. That mother will take the child. The pediatrician should hold the ear lobe of the infant and the left hand. Just a moment, I will check the connection. Okay, it is little bit Some technical issues are there at sometimes. Yes. Cursor, mouse problem. Okay, no problem. So the pediatrician or the goldsmith, sometimes we do also with the goldsmith, should hold the earlobe of the infant with the left hand and slightly pulling it towards his side. That means I am pulling this on my pediatrician's side and should pierce the earlobe in the area which is the least thick, in the center, very center, least thick and more translucent part with a sharp needle but sterile. Always remember, sterile. In a single prick, not like this, single prick. In males, the right ear is pierced first, right ear is pricked first, while in the females, the left ear, after both, first right, then left. In the ladies, first left and then the right. Okay. Post piercing, a cotton thread soaked in oil should be placed in the hole. The thread should be changed every after 3 days by more thick. Like we take the stitches, it's a simple thread. Also, we use the cotton thread for the stitches in the operations. Okay. Snehana and Svedana should be applied daily till the wound is healed. A little bit oil application, but not too much, remember. And be careful. Sterility is more important. Otherwise, infection will take place. Possible complications, that's what I have mentioned. Jwara, sometimes if infection starts, fever can appear, burning will be there, then pain will be there. Always the child will go with the hand like this. Then granthi, small cyst will be formed. Then also shirograha, manyastama, because it is very near to the head and the neck. And karna shula will start. Now, raksha, artha, that is protection, and abhushana, ornamental purpose. This is done for the two things. One is a immunity building, that is protection, and second, just aesthetic, saundaryopasana. Okay. The procedure also helps in understanding the development of immune system of the infant by assessing the secondary immune response towards the external injury, how the body is reacting. So body is put in an action of trauma. We can be considered as like antigen, and the body is stimulated to get it accepted with the external trauma. So it's a practice of the body to get acquainted with the external trauma. So this is, we are setting this samskar in another way, like we call it as something like immune system sensitization. But of course, nowadays we have the vaccines official, so need not to be more importance to this. Of course, we are doing the Karnavedan, but it is not, if you do Karnavedan and stop vaccination, not like that. You can do also the vaccination in addition, because it is 100% proven things. We will go for the next samskar, that is Annaprashana. Annaprashana samskar. Now we are talking about Phalaprashana, and this is Annaprashana. This is little bit late, 10th month. After the development of teeth, after the development of central incisors on an auspicious day, after again praying to the god, prepared food should be mashed. Mashing is more important, and fed to the child. Later, gradually increase of the food substance should be given to the child. First day, only 1/4 little rice or little chapati, and slowly, steadily we start increasing. This is actually done by the families years together, generation to generation. But we must understand what is the logic behind that thing. This is the logic. Last column is most important, which gives you the practical importance, practical utility, and logical scientific thought behind this samskar. Nutritional demand of the child increases. We have started 6-month Phalaprashana, now the Annaprashana. By the 10th month of age, gastrointestinal tract, GIT, or digestive system is also more matured. Enzymes are started secreting pepsin, trypsin, lipase, etc. and child is able to masticate little bit food, it also helps in assessing the developmental process of the child. It should be able to sit without support now, start holding the objects like spoon or hand in the hands, and should demand for the food by producing the sound. Mum, 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 mum. So these uttering of the word. So everything, that coordination in the sensory organs, motor organs, this is gradually trained by doing these sanskaras. Try to understand what is the purpose. Now, if you remember properly, in the nervous system examination, that video is already there, for even the seniors, citizens like Alzheimer people or cerebellar tumor people or the brain tumor, we always do some coordination test. One test I very interestingly remember, there is a test which is called as a finger, nose, finger test. We ask the people to do this like this. First with the open eyes and then close the eyes and do the again. Finger, nose, finger test. Finger, nose, finger test. Finger, nose, finger test. So this is a coordination test. Similarly, the child is taking something, chapati or the rice, and movement towards the mouth. So this action, coordination is very important. That indicates that your nervous system is properly developing. When the person is paralyzed, hemiplegia, stroke, cerebrovascular accident, then they lose the motor power. And now, when he starts physiotherapy, what is physiotherapy? Physiotherapy is a training to the movement of hands, to the coordination movements, sitting, sitting, etc., etc. Okay, so these in all samskaras, we are developing our physiological capacities one after another. This is my principle of this today's lecture. Okay, next samskar is a chuda karma. Chuda karma. First year or even the third year, anytime you can do it. First, complete the hair shaving of the child is done as a samskar, because it may interfering the status of the shape of the skull. Remember here, when we cut the hair, automatically internal part is exposed and you can understand the status or the shape of the skull and the fontanelle, cranial structures. The hairs which are present till that time are from the intrauterine hairs, which are said to be non-beneficial, and they are weak. Try to understand, intrauterine hair growth is weak. Hence, in order to get good scalp hair, this chuda karma is done. First time, shaving of the head and removing the hair from the head by just keeping a tuft of hair. So the purpose, try to understand the purpose. We want to check the scalp. Is there any problem? Is there any deformity? Everything is anatomically okay or not? Then also we know that the intrauterine hair don't have the strong hair roots. So we want to stimulate the hair roots. We want to stimulate the hair roots. That's why this particular samskar is done. Next, Vidyarambh. Vidya is a knowledge gaining process. Second year or third year, you know that this period, even in the home, we start little bit telling to the mama, kaka, dadda, me, getu, mala, de. And what is this picture? Apple. What is this picture? Who is this? Photo, mummy. He is my papa, baba, I, etc., etc., whatever that. On auspicious day, the child is taken to the temple. Everything starts with purity of the physical level and at the mind level and emotional level. The introduction of letters, Mulakshara, A to Z, A, A, I, I, U, A, I, O, Aha, in Sanskrit or in Marathi or in Devanagari, in modern A, B, C, D, E, F, G alphabets. Word is conducted, the hands of the child is held by the father. मुळाक्षर गिरवणं, आम्ही मराठीत त्याला मुळाक्षर म्हणायचो. गिरवणं, with the hand supported by the father, the child is moving his hand. Oh, ah, go. With the support of the father's hand, the child is learning the process of coordination and writing those particular letters. Names of the god are written on a plate filled with uncooked rice. Huh? The age of 3 years and above is the right period to observe the pervasive mental disorder like dyslexia in coordination. Dyslexia, which can be assessed by seeing the writing pattern of the child. See, what is the science behind that? At that time, nobody was in the Kashyap Samhita, Charaka, in Veda, Atharveda, never. Dyslexia word, you will say, sir, that was a Shah Rukh Khan's film. I know. But my dear friend, this is the interesting part, that we should now able to interpret. We should be able, because in between there is a losses of the different granthas and text, and a Gurukula system is lost. So everybody is in a question mark. Why this? Why that? Why this? Especially all the Vedic rituals, cultural rituals are always challenged. Objection, my lord, by the modern community, by the modern doctors, by the modern pharmacologist, by the modern scientist, by the physicist, chemist, biologist. Everybody is attacking. Rather, not everybody. I'm sorry. I'm extremely sorry. But some people, they're always having a great, what you can say, the anti question mark. Why you are following Vedic rituals? Why you are following cultural rituals? Is there any science? Is there any science behind this your activity? And many times we cannot answer. Why we make the chanting of the bell in the temple? Why we go to the temple? Why we make the salute? We must be able to answer these questions in a scientific manner. And here is that you are understanding in today's lecture. In each samskara, we are talking about the science, logic behind that samskara. And in the oral examination, if my students, after seeing this lecture, if they answer in this way, your examiner will be 100 out of 100. Oh, fantastic, superb answer. So try to remember, this lecture is fantastic and very interesting for everybody. Please share this lecture. Please share this lecture. So at the age of 3 years, we are want to test clinical examination, dyslexia, which can be assessed by seeing the writing pattern of the child. Early identification definitely help for receiving the proper treatment. Next. This is called as Upanayana or Vedarambha Samskar. Upanayana. 5th year onwards, going to the school. Lower KG, upper KG, first standard. This child is inducted into regular education. 95% of the brain development occurs till the age of 5 years. Now brain fully, come on, sensory, motor system, everything is ready to act. Intelligence, then what you can say, the centers are already developed. Motor center, sensory system, intellectual center, forebrain is for intelligence. Everything has been developed. Child would be able to speak fluently, analyze the matter, and understand what is going on in front of you. Too early initiation, because many families are crazy families, and they have the crazy ideas in their mind. Every parent wants that his child should be Einstein, next to the Einstein. So don't make such a comparison. Your child is your child. That is a gift. This is a child of the God. So there is no comparison of this child and that child and this scientist and this. Nothing. Everybody is own identity. So remember my words. And so in his early education, premature education may not be fruitful to the child and may overload the mental capacity. A simple thing, if you are learning in the 5th standard and you are given the 10th standard paper, question paper to solve, is it possible? No. If you are in the 10th standard and if you are giving the last year graduation paper, is it possible? Not possible. If at the moment you are learning third year BMS and you are giving the paper for the last professional year and you are asked something about surgery, how you can learn? No, not possible. Your capacity, that's why the 5 subjects for first year, 5 for the second, 5 for the third. Why? Because they know that this much is the limit for that particular year. Premature force is always making the problem for sitting, for learning and all these things. Next, maybe the last samskar of today's lecture, Keshant, 10th or 16th year, shaving, because there is these are lakshanas are hormonal development, testosterone development, estrogen, progesterone development, puberty has been started, secondary sex characters are developed, Jat Vyanjana Lakshana, secondary sex characters based on the hormones. So it is indicating hormonal development is complete, and then at this age, that particular child has to be treated friendly by the father, not by the scolding and all this thing, physical scolding. No, not good. Okay. Shaving of axillary, pubic and facial hair for the first time. This indication of appearance of secondary sex characters, and child is now grown up. He may be voting for the upcoming elections. Okay. So child becoming an adolescent. So my dear friends, I think personally that today's lecture is a fantastic lecture because we are trying to discuss not only samskar method, but the science, medical importance behind that particular samskar. We have still 8 minutes in hand, and Dr. Deshpande style, Kshane Nashte Kuto Vidya. Every second is important in the education process. So every time Deshpande is stressing, you must remember the syllabus points. You must remember the past question papers. And anytime you are asked, pick this point for 5 minutes, you should be able to speak. And always make the habit of speaking, talking with your parents about your subjects, talking with your friends about your subject, talking with your teachers about your subject. That will make you confident, because finally, when you become a doctor, consultant, you are public relation officer, PRO, public relation officer, because you cannot sit in your own room and do the net and internet and work. No, you have to talk with the patient. Kai mama kasa hai? Aji bara vatte hai na? How your uncle? Fine. How is the grandpa? Is okay. So you have to make a habit of dialogue or conversation. Anyway, so syllabal points. We have only one paper of Kaumarbhritya tantra, paper 1. So only paper 1. There is no paper 2. Part A and Part B. So once again, remember the points of the Part A. First is a general introduction and scope of Ayurvedic paediatrics or Kaumarbhritya tantra. There we must know the definitions and different terminologies used in the Kaumarbhritya tantra. Then second, specific contribution of Kashyapa Samhita in the subject of Kaumarbhritya tantra. Third is a Vayobhed, classification of age. Fourth, Prana Pratyagamana, very important, that is neonatal resuscitation. Neonatal, when the child is not crying, what to do? Emergency, neonatal resuscitation. Fifth, Navajat Shishu Paricharya, neonatal care. Sixth, Navajat Shishu Parikshana, examination of the newborn. Seventh, Navajat Shishu Poshana, infant feeding. Eighth, Stanya Dosha, that is a vitiation or the problem of the breast milk. Ninth, Garbha Vruddhi Vikasakrama. I have already video uploaded, milestones. See that video, milestones. 10th is a Poshana or the nutrition. 11th, dantotpatti evam dant raksha vidhi, brushing etc., that is dentition and dental care. 12th is a vyadhi kshamatva, that is the immunity. 13th, prashana and lehana. 14th, knowledge of national programs reflected to the child health care, that we have already seen. Now, part B, that is Bala Pariksha Vidhi Evam Shishu Vedana Parijnanam. Because child cannot tell, my ear is paining, my abdomen is paining. How to identify where is the pain? Very interesting. Where is the pain? Okay. Examination of the sick, SICK, sick child, and diagnostic methods. Of course, Ayurvedic and modern. Part B, we are talking about general Aushadhi Matra Nirdharana, medicine doses. Third, specific therapeutical panchakarma procedures in the children with special references or emphasis on the snehana, oil massage, svedana and basti. Fourth point, prasava kalina, during the delivery, abhighat, that is birth injuries by forceps, etc. Fifth, brief description of sahaja vyadhi, that is congenital disorders. Sixth, brief knowledge of genetic disorders. Seventh, prasavottar vyadhi, that is neonatal disorders. Part B, we are talking about. 8th point, dushta stanya pana janya vyadhi, disorders due to vitiated milk. 9th, kuposhana janya vyadhi. Kuposhana. The famous are marasmus, kwashiorkor. Videos are there. Dr. Deshpande's marasmus. What is that? Protein calorie malnutrition, PCM, marasmus. Kwashiorkor, only protein deficiency. Videos are there, please check. Kuposhana janya, vitamin, then another things are there, vitamin A deficiency, vitamin night blindness, vitamin C deficiency, immunity problem, all things are there. Then next is upasargika vyadhi, infectious diseases. 11th, from 11th, srotas vyadhi, pranavah srotas vikar, like kas and shwas. Annavah srotas vikar, like atisar, pravahika, aruchi, agnimandya. Rasavah srotas vyadhi, like jwara. Raktavah srotas vyadhi, tvacha vikar. Mouse medovah srotas vyadhi, like fakk or the obesity. Mutravah srotas vyadhi, mutra krichra, mutra dah, mutra ghat, mutra kundalika. There are different vyadhis. Anya balavikar, miscellaneous, which are not included here, miscellaneous, other pediatric problems. Part B, we are talking about Kaumarbhritya tantra, behavioral disorders, behavioral disorders of the children, their management and counseling. Next is a prana raksha vidhi. Oh, life-saving measurements. We have to protect the life of a child. And last chapter is Balagrah, that particular problems in the child due to the invisible particular thing. It may be the bacterial or microorganisms, or it may be the psychological thing. But these are included in the Balagrah chapter. So my dear friends, I think this is enough for today because we have learned a lot in this lecture. Now we will see on the Sunday in the morning for Swastavritta and in the afternoon for Charaka Samhita Uttararth. So thank you very much once again for your nice support. All the best. Take care and see you soon.